During a periodic checkup, now for some people that's 6 months, some people it's 9 months, sometimes it's other lengths of time. Often what the dentist is doing is having a good look around, comparing what we can see now to what we've seen before, and also trying to make some predictions about what the future might hold if the status quo is maintained, and whether we need to interfere with that or try to modify it in order to prevent a foreseeable problem. So there's the examination component, which is largely that. There's also the preventive component in terms of trying to work out areas where a patient might need some help in terms of getting the best results from their oral hygiene regime at home. So that's really important, but also we'll often do a good clean and usually some sort of fluoride treatment at the time. The reason the clean is really important is that it helps to reduce the number of bacteria in the mouth that are capable of causing problems like tooth decay or gum disease. The clean also helps us to get a really good sense of how healthy the gums are and to intervene with that if it seems as though the gums need some help. The fluoride treatment that usually happens for most people at the end of that sort of periodic appointment, the fluoride treatment is really important because fluoride helps us to reduce the risk of decay in two ways. The first way is physical. It helps to strengthen the tooth structure against decay by building some fluoride into the tooth structure. The second way is biological. Fluoride helps to inactivate a specific enzyme that the bacteria would sometimes use to produce decay acids. So if we can interfere with that enzyme, then the bacteria are much less likely to be able to produce a decay cavity, and that then saves some time and money for the patient. In terms of what fluoride can do without bacteria, it can also help to harden up the teeth against acids from other areas. For example, gastric reflux, if people have an issue with gastric reflux. The other thing would be dietary acids. A lot of people these days are drinking citrus fruit juices mixed with warm water, which is possibly very good for the rest of the body, but it can hold some dangers for the teeth if you're not careful. So a bit of fluoride can help to protect you from dietary acids as well.